From the expansion of private health care in our province to Alberta health workers voting on new contracts. Time now for tonight's politics panel. And joining us this evening, Mount Royal University political scientist Laurie Williams, and Barry Morishita is former leader of the Alberta Party and a former mayor of Brooks. Good evening to you both. Let's begin with building reaction to legislation introduced this week that will expand private health care in our province. Laurie, we heard from health law expert Laurie Hardcastle off the top tonight. What do you take away from the government's approach to this policy shift and the degree to which it is prepared to carry it out?
Well, I'm not clear on what they're planning to do in detail. They're saying that they're not somehow breaking the election promise, saying that public access to healthcare would be preserved. They're not addressing the real problem, which is the shortage of medical workers. That's the issue, and this isn't adding people to that pool of personnel. The idea that doctors will somehow be required to do a certain number of surgeries in the public system before they can do them in the private system, I don't know how attractive that's going to look to doctors. So at this stage, I think we've got more questions than answers, but we've seen what happens in other jurisdictions. We see the mess that Quebec is in right now. They're really having difficulty getting docs to do the kind of work that needs to be done. And their attempts to try to remedy at this stage are leading many doctors to say they're going to leave the province entirely. Here, I think we're looking at I mean, look at what's just happened with nurses who've gone through contracting organizations. They get paid more, or at least the government has to pay more for their services. So it actually costs the healthcare system more money, and it doesn't increase the pool of available personnel. So I have more questions by far than answers at this stage.
Barry, the policy shift broke cover last week through news coverage. It drew considerable buzz now that the legislation has been introduced. Have Albertans had enough of an opportunity to weigh in with a say of their own, whether that's supporting or opposing such a significant policy shift?
Well, I think the problem is that the outcomes aren't going to change. I mean, originally the government promised 100 days healthcare was going to be fixed. Now they've reorganized and said healthcare was going to be fixed. And to this point, it's not positively affected patients. And that is going to be the political baggage that this government waves. Taking a purely ideological bend on this solution isn't going to result by most estimations in any more lines being shorter, people having access to the health care they're looking for. And that's the political price. So I do not see this as a long-term solution. And I think residents or the people of Alberta are going to be measuring it by how long they're in the emergency room, by how long they're waiting to see a family doctor. And as Laurie said, there are no more doctors than we had a month ago, a year ago, really practicing. And therefore, there won't be more capacity. And that's going to be a problem ongoing here in Alberta.
Laurie, a lot of focus right now on the influx of recall petitions, many motivated by the Smith government's use of the notwithstanding clause. To what degree, though, do you see this health privatization playing into that petitions dynamic?
Yeah, I'm having a hard time understanding the government's strategy here. So they get significant blowback to legislating teachers back to work with no binding arbitration and using the notwithstanding clause. They haven't explained why that was somehow necessary to do in order to get teachers back into the classroom. Then they double down by adding the notwithstanding clause several more times. And then on top of that, they announce in a video online that they're going to provide private surgeries on top of whatever's going to happen in the public system, which appears actually to be a betrayal of an election promise that they made. So they're continuing down a road of very controversial decisions, and all the folks that were angry with the recall campaign, with the legislating teachers back to work that have been involved in the recall campaign, that's just like a magnet attracting more people to participate in the recall.
Barry, is there anything to stand in the way, deter the government from acting on this privatization policy shift?
Well, not in the short term, because as Laurie just said, I don't understand the kind of political strategy they're using to do this. As you say on the recall, they say they don't have reasons, but now they're just giving them reasons. Privatization of healthcare, just the word of it, gets a lot of people excited. The video is like 8 minutes long or something. No one's going to watch that whole thing. So I think this is just going to put fuel on the fire. So this strategically, I don't understand it. I think the government's trying to maybe make it through November again, another convention where where the hard right rump of the party has got a lot to say about what happens there. And then I don't know, maybe the strategy will change, but it's going to be not a government that's going to be able to, communicate from a position of strength with some of these strategies they're using, because they're just falling on deaf ears in the public right now from everything I can see.
Laurie, one last question, given the window opening here, what are you watching for now from the Smith government?
Well, Barry might be right. I mean, a lot of people are speculating that what's going on here is that they're focused on the AGM and they want to get through that, and then they may pivot after that. I don't know how you pivot away from using the notwithstanding clause on 4 pieces of legislation. I don't know how you pivot away from floating this idea of privatized healthcare without addressing successfully at all the concerns that Albertans have about access to healthcare. So folks that are facing concerns about affordability, facing concerns about education and about healthcare, those numbers are growing, and it isn't clear that this is the sort of thing, especially with the momentum that's building here. It's not clear to me how you can reverse course after this series of moves. I mean, governments accumulate a record over time. We talk about political capital, and all you can do is withdraw, and there's not much chance of putting things back in. This really puts them in a very difficult position to try to recover from. And we're hearing from all the MLA offices are being inundated with folks that are angry about all of these things. That anger, that dissatisfaction is percolating up through constituency offices and through the MLAs and caucus meetings. But I don't know how you recover without actually reversing some of these policies.
All right, time for us to take a bit of a break. When we come back, though, the prospect of labor stability with healthcare workers voting on new contracts. More from our politics panel in a moment. Welcome back. 66% of Health Sciences Association of Alberta members have voted in favor of a new collective agreement with AHS. It covers more than 22,000 employees, including mental health and addictions counselors, social workers, paramedics, pharmacists, and psychologists. HSAA says the agreement includes a 12% wage increase over 4 years and a $54 million fund to retain and recruit workers in rural Alberta. Meanwhile, nursing care workers began voting today on a tentative deal that was reached this past weekend, literally at the last moment as AUPE members were launching strike action. Barry, I'll start with you first this time. 67% support, 67% in the case of HSAA voting. Not exactly overwhelming. It means 33% of members were opposed. What does that reflect to you about the agreement, how it landed?
Well, I think with members, obviously, 2/3 agreed that this was a good enough deal and they took it. Again, I think for this government, the problem is that it's not going to make a large difference to how healthcare is delivered, and hence Albertans are going to be still upset about this, and I think that is going to permeate for a long time. I think a disaster would have been had they actually gone on strike, and I think the government did all they could to do that. So politically good for them, they managed to avoid that. But at the end of the day, it's not going to do a lot to deliver to Albertans, and ultimately that's where the test will be made, and I think the government's not on a good course in that regard.
Laurie, what degree of stability does the HSAA acceptance of this agreement bring to labor dynamics in the health sector?
Well, they've got contracts. I've seen also all over social media, people are asking questions about why they couldn't have managed the teacher strike better than they did, and why they are coming to deals here. So again, the echoes of their mismanagement of the teachers' strike, I think, are still with them. But Barry makes the most important point of all, and that is, if this doesn't help the healthcare system, if it doesn't attract workers, if it doesn't deal with some of the challenges, people are having trouble getting family doctors, getting the treatments and diagnoses that they need. We have all this information about the concerns that were raised with Dynalife and how privatization in that case wound up costing $123 million and no benefit accrued. In fact, it diminished access to diagnostics for a period of time. I just think all these questions about the healthcare system are going to persist unless and until something significant starts to move things in a direction where people have the access that they need.
Barry, on the AUPE side, surprised the nursing care workers, the strike that was very much about to happen was avoided with a last-minute deal. What does that say to you about maybe pressure on the provincial government?
Well, I think it is high. I think, again, Laurie mentioned the mismanagement of the teacher strike and the lingering issues that's going to create for this government. I think the same thing with healthcare. I think they had to make a deal. I think the other thing I have to say is that the workers on the healthcare side, they're very committed people. They do not want to strike. They do not want to put their patients' health in jeopardy. And I think, that played into it. At the end of the day, though, the issues in the healthcare system are going to perpetuate. Knowing people who work in it and listening to what they're going through right now is not going to result in a better product. And I'm happy the government didn't go the route they did with the teachers, but at the same time, they have a lot to prove on that file in order to regain confidence from Albertans.
Laurie, as tenuous as that situation was over the weekend, the verge of strike action, what do you see hanging on the AUPE nursing care workers' vote now that it is underway?
Well, obviously, if it doesn't succeed, then that's going to be a huge headache and problem, not just for the government, but for folks who need to get access to the healthcare system. So I think a lot hangs on this. It avoids or diminishes adding problems, if you like, to the government's plate. But I don't know that it's given them a particular gain. I don't think they get a lot of credit for that. I mean, the best news for Danielle Smith in months is this agreement, this memorandum of understanding with the federal government. And that's a bit of a mixed blessings. On the one hand, she can claim a victory. On the other hand, now there's more responsibility on her to try to get the agreement from the British Columbia government and Indigenous peoples. She and other leaders in Alberta will have to work on that in a concerted way. But it'll be harder to point the finger at the federal government and distract from some of these issues in healthcare, education, and affordability in Alberta. So this is a long game, and it's getting harder.
All right. We'll have to leave it there for time. Great to see you both. Thank you kindly for this.
Thanks, Michael.
Thank you.